Exercise Ventricular Function Test evaluates the pumping action of your heart. With coronary artery disease, the heart muscle may not receive sufficient blood during exercise. An exercise ventricular function test is useful in detecting the presence of coronary artery disease. There are special preparations for this test. You can have a light breakfast and decaffeinated coffee or juice the morning of the test. You must avoid caffeine, no tea, regular coffee, or chocolate. Please bring shorts, jogging pants, or comfortable exercise clothing and shoes, preferably running shoes for exercise on a treadmill. You should also bring a list of all your present medications. The physician who referred you for this test may decide to temporarily discontinue certain heart medications prior to the test. These are discontinued because they may offset the effectiveness of the test. You must be informed about whether to discontinue these heart medications 48 hours before the test. You can resume your medications following the exercise portion of the test and throughout the remainder of the test. Before the test, you'll be asked to sign a consent form. You should read it carefully and ask the technologist or the physician supervising the test any questions. The technologist or the physician can explain the entire procedure before it begins. The test consists of 2 injections. The first injection contains a substance which is taken up by your red blood cells. It takes 20 to 30 minutes for it to circulate in the bloodstream. The second injection contains a radioactive substance. The 2 substances allow a gamma camera to visualize the blood in your heart. The radiation exposure from this test is comparable to the radiation you are already exposed to from the naturally occurring radiation in air, water, ground, food, etc. You won't see, smell, taste, or feel the radiation, and it will be quickly eliminated from your body within a day. Several electrode pads will be placed on your chest after the first set of pictures have been taken. These pads will be connected to an electrocardiograph, ECG monitor, so that you can be watched closely throughout the test. You will lie down on a bicycle bed with the gamma camera positioned close to your chest. You will take a set of 4 pictures before you start exercising. It takes 2 to 3 minutes to take each picture, and it is important for you to lie as still as possible during this time to avoid blurring the images. You will exercise by pedaling a bicycle, which increases the resistance in 3-minute stages. As exercise increases, the heart rate and blood pressure will rise. This is a normal response, and it will be monitored along with the ECG. A second set of pictures will be taken while you are exercising. These pictures are compared with the first set to assess heart function at rest and during exercise. The entire test lasts about an hour and a half. We encourage you to exercise for as long as possible because this increases the effectiveness of the test. If you experience any symptoms at any time, such as chest pain, shortness of breath, or lightheadedness, you must immediately tell the individual monitoring the test so that adjustments can be made. When the test is complete, KMH sends a written report to your referring physician who will explain your test results to you.